Then I moved to Australia as a general practitioner. Also, I am now serving the president of Australian Bangladesh Health Forum. The reason I introduced myself because of being I had the opportunity to work in different places. I can reassure that Australia is the best place to work and live. Quickly, I'll be going through some introduction about ABHF, Australian Bangladesh Health Forum, which was born from a shared vision among a group of Bangladeshi doctors who believed that health professionals of Bangladeshi origin in Australia needed a common platform, a place where we could connect, collaborate, support one another, and contribute meaningfully to both our professional community and the wider society. Over time, that vision expanded beyond doctors to include dentists, pharmacists, nurses, allied health professionals, academics, and many other. Today, ABHF stands as a unified voice for Bangladeshi Australian health professionals, promoting networking, professional development, peer support, advocacy, and community initiatives. This webinar series is part of our ongoing effort to share knowledge, guide newcomers, and strengthen our professional pathways within the Australian healthcare system. I sincerely thank our speakers for their time and expertise and all the participants for joining us today. Your presence reflects the spirit of collaboration that ABHF was founded upon. Now, I would like to invite Dr. Mahbuba Khanam Mukta, Vice President of ABHF, to speak about the aims and objectives of today's webinar. Thank you all.
Assalamu alaikum. Thank you so much, Dr. Datta, for the lovely introduction. I'd like to warmly welcome everyone to today's webinar. Let me quickly introduce myself. I'm Dr. Mahbuba Khanum Mukta. I'm one of the vice presidents of the Australia Bangladesh Health Forum, and by profession, I'm a GP, general practitioner. I moved to Australia permanently back in 2003 as an international student. And honestly, when I look at many of you here today, I see a bit of my younger self in you. When I first arrived, there really wasn't much help or any clear structured guidance on how to pass the AMC exam or how to navigate the whole process. We basically went anywhere and everywhere just to get bits and pieces of information, which was sometimes very frustrating and demotivating. A lot has changed since then. This is now 2026, more than 23 years later. The exams have changed, the process have been updated, but surprisingly, one thing hasn't changed much. The lack of proper support and clear guidance has remained largely the same. And that's exactly why we felt we needed to do something. This webinar is about helping you understand the process better, showing you how to navigate it, and supporting you whether you are already here or still thinking about coming to Australia as a medical or dental graduate to join the Australian healthcare system. So, let me introduce you to our speakers. First, we have Dr. Rizwana Rahman Nipa, who passed her ADC exam in 2023 and is now working as a dentist at Pacific Smiles Dental in Maitland. Dr. Rahman is a very efficient member of our ABHF community and a proud mother of two children. She is a great example of how to master multitasking. We will be hearing Dr. Rahman's advice very shortly, but just before we begin, here are a few house rules. If you have any questions or any queries, please write them in the message box and we will address them at the end of the session. If you drop out of the session for any reason, please rejoin using the same link. Now, let's start with our first speaker, Dr. Rizwana Rahman Nipa. Thank you.
Thank you, Dr. Mahbuba Khanum Apu, for your nice presentation. I'll just share my screen so that everyone can see. So can everyone hear me and see my screen, please? Okay. Good evening, everyone. Thank you for being here today. My name is Rizwana Rahman, currently practicing as a dentist in Australia. I do appreciate the support from Australian Bangladesh Health Forum team for organizing such a nice webinar. Australia is a I feel like it's a great choice of country to move on and practice. If you are planning to practice in Australia, we have to have a license from Australian Dental Council. They will assess your knowledge, judgment, clinical skills, and professional competence through ADC exam. The ADC pathway can feel confusing and overwhelming at first. I've been through this process, guys, for myself, and today my goal is very simple, to give you a clear idea and knowledge, honest overview of what ADC process involves. By the end of today's session, I hope you feel more informed, more confident, and more realistic about the journey ahead. Now, this process involves three stages. The first step is the initial skill assessment. At first, we need to create an ADC Connect account. Application type will be initial assessment for skill assessment. Documents are usually your current passport, Australian passport size photo, BMDC registration certificate, academic transcript, and internship certificate. Once you apply, the assessment usually takes around 8 weeks as long your documents are complete. The approval is valid for 7 years, which will give you enough time to clear this exam. One important thing to remember here is the delay usually happen because of document issue. Now, applying for the written examination. After completing the initial assessment, you can then apply for the written examination. The booking happens in two stages. First, you apply for the ADC for examination place through ADC Connect. Once approved, you then book your exam venue through Pearson VUE. Now, good news is Pearson VUE has centers in Bangladesh, and you can complete your Part 1 or written exam while you are in Bangladesh. You must also make sure your identification documents are verified in the ADC system before exam day. Now, written examination format, it's fully computerized delivered exam, scenario based exam will happen in 4 section. Day 1 section 1 and section 2, in between there will be rest break, and day 2 section 3 and section 4. So each section will gonna have 70 SBQs, and each SBQs will come 5 multiple answer question. Now, the blueprint. The blueprint is one of the most important thing to understand. Total 4 competencies involved, like 4 domain: professionalism and health promotion, clinical information gathering, diagnosis and management planning, and clinical treatment and evaluation cluster. So usually we have to pass all the cluster to complete our Part 1 exam. Now, in terms of subject, there are a couple of subject here where you can see the percentage as well. Like most of the 14% question comes from the restorative dentistry. There are preventative dentistry, pediatrics, periodontics, dental emergencies, and some question comes from general medicine as well. Book must cover, we usually say therapeutic guideline is a Bible of ADC. Apart from that, Australian Dental Journal, Infection Control Guideline, previous question bank, they will give you some idea as well. So this whole idea tell us the exam is simply to judge your knowledge, your clinical judgment and skill relevant to dental practice in Australia. Now, this slide is showing us a typical scenario-based question. You will be given a patient case, often with attached some photos or x-rays and some background information. Then you will answer multiple, usual 5 questions based on that single scenario. The key thing is to remember is your clinical judgment and critical thinking and patient-centered care can help you to find out the correct answer. practical examination content. After passing the written exam, you move on into the practical exam. The exam is designed in two session over 2 days. One session is clinical skill day, where you have to focus on three main domain, which is same as the part one: clinical information gathering, diagnosis and management planning, clinical treatment and evaluation. They will come in 6 room as a OSCE interview. Another 4 room will be technical skill OSCE, where you might ask for rubber dam, facial sealant or X-ray processing. This exam is organized to assess whether you can practice safely and ethically as a general dentist in Australia. The second session is the technical skills day, where you have to focus on hands-on procedure on mannequin. Here, infection control are critical. Time management and also following proper guidelines are very important. It's not all about your picture perfect task, but it's all about how safe, how professional and how functional your task can be. I remember printing this photo and attaching in my practice room, so that when I will go to the exam, the exam environment will be so familiar to me. Now, there I will want to highlight 3 points here. Number 1 is hard work. There is no shortcut in ADC pathway. 2 is perseverance. Many candidates don't pass in their first attempt, which is totally fine. Always just never give up. Number 3 is knowledge with contest. Always think in terms of Australian guideline and standards. If you stay consistent and focused, this exam is achievable. ADC is definitely an expensive journey, guys, but if you work smartly, I do believe it's worth spending your time and money to achieve your goal. Now, I would like to thank you all for your time and attention. I hope this session helped you understand the ADC pathway more clearly. If you have any question, you can just write down in the question and answer section. We will have our second session regarding ADC exam in brief and job opportunity on 27th of March. I wish you all the best for your preparation and future journey in Australia. Thank you, guys.
Thank you so much, Dr. Rahman. Our second speaker is Dr. Abhishek Vadra. He passed the AMC MCQ exam in 2024 and has since been mentoring AMC Part 1 candidates through his platform called AMC Mentor. He moved to Australia in 2025 and is currently preparing for his next steps. This actually places him in an excellent position to share some practical insights into the AMC pathways. Please welcome Dr. Vadra. Thank you.
Thank you, Dr. Mahbooba Khanna. So hopefully I'm audible and my slide is visible, right?
Yes, I
Okay.
can hear you. Yes, all
Thank
good.
you. Thank you. Welcome, everyone. Welcome to our session. And before starting, I want to get the opportunity that I would like to thank ABHF for giving me the opportunity and the invitation to present some insights and some experience in front of the doctors community of my country. So before starting, just I would like to say that what is inside the presentation. It's not like a typical presentation. It's just so sharing some information here. So that's why the name is what you need to know before planning your AMC journey. I know we have a lot of doctors in our country. They are thinking about or they are planning about they will start the AMC journey or someone already decided. So I think there are some few things from today's session that will really help you to shape your planning or it will make your journey easier. So let's start. Okay, so you need to touch some of the milestones. We know to achieve a goal or achieve a aim, you might have some milestone that will really help you to track your journey, right? So what are the main milestone you need to crack throughout your AMC journey? So these are the initial milestone, I would say. So passing the AMC MCQ exam. I know you all know it's like a gate opening. So there are some steps. Before that, we will discuss it later that you need to book, you need to do EPIC, whatever it is. The main, your main milestone or the initial milestone will be the passing the AMC exam. And next, you need to secure a job, the first job offer. It can be the hospital job, it can be the GP job, whatever the things. That is the another important milestone. And the next, you need to obtain the general registration in Australia as a doctor. And finally, your pathway to be a specialist or a GP practitioner. So that's our a overview of your entire journey. So now we will talk about some pathways. Just see, here is a doctor. For example, you are that doctor, maybe a fresh graduate, or you might have some experience after passing the exam. You are in your country. So from your country, if we all want to work in Australia. So in this way, there are some pathways. So first pathway is the standard pathways. So standard pathway, you need to sit for the exams like through AMC MCQ exam or AMC clinical exam. You need to complete this. And in the second pathway is competent authority pathway. This is basically who have the registration in other countries like GMC registration, like registered as a doctor in Ireland, New Zealand, or USA or any country. They are eligible for this competent authority pathway. And the last one is the specialist pathway. This is for the person who already completed their specialty. They also have the chance to transfer their registration or to get the registration in Australia as a doctor. So what will happen with all this, any pathway, you will be here. And then you have an opportunity. There are lots of career opportunity to be starting your career, maybe as a GP practitioner or any specialist, and or in other non-clinical sector as well. So this is basically an overview of all the pathways. Now the step-by-step journey of a IMG. So you can think that you are starting from here. You are a doctor from your country. So what you need to do, you need to do some EPIC verification, establishing your portfolio, and there are lots of preparatory steps here. Then you can sit for the exam. If you pass the exam, then here is a tricky point that you have three options. For example, who will get job after passing the MCQ exam? So for him or her, this is the pathway. He can secure, if you secure the job first, then you can apply for the limited registration, and then you can complete your clinical exam during your employment. And with the 12-year journey, you will get ultimately the general registration, which is one of the important milestone of your journey. So if someone after passing exam, one can plan for the clinical exam first. Even if you plan sitting in your home country, it's fine. So then you have to secure a job, then provisional registration, then 12-month training, and then the registration. And the interesting thing is that there is an option 3. If you secure a job where there is work-based assessment is there in that place, so that is a completely alternative of the clinical exam. So you need not to do the clinical exam, but during your working time, this is work-based assessment. You will pass all the criteria, and you can get or eligible for the general registration. So, and obviously you can go forward with this pathway. Now, I would like to give you a very short screenshot or a snapshot regarding the AMC MCQ exam. It's you all know it's a best of 5 questions, SBA type questions. This is a sample question, and the duration is 35 hours. 3.5 hours. Total question 150, total marks 500, and pass mark is 250. But the marking system is a little bit tricky. It is not the all question doesn't carry the equal marks. So here it is not guaranteed. If you correct the 75 question and you will pass the exam, it's not like that. So the next thing is, here is the overview of your syllabus. You will have the question, 30% question from 150 question is medicine, 20% from surgery, 12.5% from mental health, same from gynae, same from child health or pedi, and last on the population health, that is public health and stat, you will get the 12.5% of your questions. So now about the MCQ center, exam center. Yeah, unfortunately from Bangladesh, you can't sit for the exam. You need to go any country. This is actually the South Asian region. It's maybe you can give exam in India, Pakistan, Sri Lanka, China, Taiwan, Singapore, Malaysia, Thailand, or Philippines. So this is the other region of the country, and this is, yes, definitely Australia have a lot of center to sit for the AMC MCQ exam. So this is the very important three steps. You just start with the EPIC verifications. It is very initial step. Then establish your AMC portfolio to book your exam, and then payment and book your slot. So this is the very simple three step you can start. And this is the cost breakdown actually. So if I say these are the fixed costs. You need to, for example, EPIC verification fixed, AMC exam fee fixed, but yes, coaching fee is variable, and definitely your travel cost, hotel is variable. So on an average, I can say it will take 4 to 5 lakh taka to clear the part on exam, okay, or MC MCQ exam. And last or finally, it is about the English test. I know there are a lot of confusions about the English test. The but key highlighting point is you need English test only when you apply for the registration. It can be a limited registration or the provisional registration or the whatever you apply first, because before that you are eligible without English. You are eligible for AMCQ exam, you are eligible for the clinical exam, even you are eligible to apply the all the jobs, all are okay. So this is the highlights, the key points about the English test. And yes, I know it's a very simple overview. We have two next session. One is the 27 March, where you get ADC in details guideline, and I will be taking another. I will conduct another session on 17. Sorry, it is 17 of March or April. Apu? I'm sorry. It's maybe all are March, right?
Yes, it is.
17 April, 17 April, sorry. Here, 17 April, my AMC session will be here, there. So I will guide you in depth of AMC MCQ exam, where you can have an idea how to prepare yourself without any support. I will try my best to give that insights from my experience. And I would request to follow our Facebook page. You can follow the Australia Bangladesh Health Forum Facebook page or my platform AMC Mentor, so that no update is missed. And finally, if you have any questions, I know it's little bit but I think it's a great opportunity for all of the doctors who are already in the country, because from our time, what we did, we call or we try to approach some random peoples, get some idea. But yes, you have a great opportunity. Whatever you have the query, just mail here, and they will be here. The Australia Bangladesh Health Forum members will be here to give you the answer or every questions. So that's all from my presentation, and it's my apology. It will be the 17th April, the AMC MCQ exam. Sorry, AMC MCQ guideline will be here, and 27 March for ADC session. So thank you all. I wish you a very successful journey. Have a good day, or have a good time till then. Thank you.
Thank you. Thank you so much, Dr. Vadra, for such a detailed informations. You have touched actually everything. You have tell us about the MC pathways, the exam types, the English course, and then including the costing and the different MC centers. It was a beautiful presentation. Thank you.
Thank you.
Now, last but not the least is Mr. Pushpinder Bedi, founder and principal registered migration agent of Wise Advice Visa and Immigration Services. He is a very experienced and highly skilled migration professional who will give you an overview of different aspects and opportunities for migration to Australia as a health professionals. So, Mr. Bedi, the floor is yours.
Thank you, Dr. Conan. Thank you. Good evening, everybody. My name is Pushminder Bedi. Like Dr. Conan told you all of you, I've been practicing migration for some time now. I'm quite passionate about helping communities, and certainly more and more helping more and more people to come to Australia. Um, these are some of our details. Company name: Wise Advice Visa and Immigration Services. You can come to our website as well, and the phone number which you see, that's also available on uh, WhatsApp as well. Now, coming to Australia, you guys will always certainly need to pass the exams step by step, but also you will need to have a migration agent besides you who can actually tell you, advise you, guide you on every step by step. So these are some of the things which we do. We deal in all types of Australian visas, partner, parent, student, and refusals, cancellations. But coming onto this platform, certainly we'll talk about how can you as medical professionals can come to Australia. Just a quick overview. The information provided on this call or on this Zoom call will be general in uh, nature. It is not for anyone's individual circumstances. For that, you can always give us a call, and please do not copy this information to so in any other unauthorized way. The information which I'm providing now is valid on day, which is 6th of February, which is today. Now, the first step will be when you will be looking for a migration agent, you might find that there are so many in the market, and whom do you find who is actually genuine or not? So the best way I tell all my clients is go to Google and type in registered migration agents. Once you are looking for that in Google, this side on the left hand side will come where you can search for a person's name, family name, Mara number, business name, and on the once you so my name is Pushminder Singh Bedi is my surname. So if you go to Google, type in this thing, this the my picture along with my details will be coming. If you cannot see this information for any, like someone says I'm an authorized migration agent, but you can't find the person's name here, there is some problem with that. The person might not be correct. Now coming on to your professions, I believe most of you are medical practitioners, but there are when it comes to health practitioners in Australia, even chiropractors, dental practice practitioners, psychologists, podiatrists, pharmacists, paramedics, these all are the branches of health practitioners who can migrate to Australia, and they all are means they have got their individual bodies, but the main body which will be um, giving license for all of this is the main body called AHPRA, AHPRA, which stands for Australian Health Practitioner Regulation Agency. My colleague Dr. Bhadra had already explained you in the past that this is just a small overview. When you decide to come to Australia, you can certainly contact us, and we'll be able to assist you to do all these things step by step. The first and the most important one is the qualification verification. You might not know where to do, how to do it, so we do it all the time. We will be able to assist you for all of verification. We will be able to help you make the portfolio on the AMC website as well, which is Australian Medical for GP, and ADC for dentist. Followed by you will need to do the CAT MCQ exam, which my colleague Dr. Bhadra had already told you the various centers available where you can go and pass that test. That test is valid for 5 years, and then after that, that's where you need to come to Australia for either giving the AMC clinical exam, or you can also start looking for some jobs, and then if someone is willing to sponsor you, you can come on a workplace based assessment. So these are the two pathways, so which you come to Australia. Now for registration or any types of uh, registration with APRA, either a full or a provisional one, you will need to have passed English test. As Australia is an English speaking country, they are very particular about people speaking in English. There are various tests which you can give, which we'll be able to talk to you in a sec. You will also need to have a police check. of any place, any country, Bangladesh and other countries where you have spent maximum of 12 months in the past 10 years. And so in this way, so these are the kind of things you might not be aware of, and we don't expect you to be knowing all this. Once you contact us, we'll be able to uh, catch your hand, and we'll be able to take you step by step with this. For English, you can the English test can be passed through IELTS academic, PT academic, or there is also one which is quite common amongst medical professionals, OET, occupational English test. Again, like I said, we'll be able to guide you with all these things as well. Workplace based assessment is there, where you are able to find one employer who's willing to sponsor you. Now that I'll be coming to, whether it will be a temporary or a permanent one. The main thing which I was to talk to you about, this is just our preliminary. We will be able to assist you with that, to make the portfolio, to get the exam done. Now, say for example, you have passed the 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 MCQ test. Now what? Now there are four common visa pathways to come to Australia. Four common. The first one and the most common one is the employer sponsored visa. Now, employer sponsored, once you have passed the MCQ test, you can start looking for jobs in Australia. From our experience, you will be better off looking for jobs in places other than Sydney, Melbourne, because Sydney, Melbourne, there are lots of congregation of people from overseas, so lesser jobs, lesser employers, so you can start looking for jobs in places which are quite far off, which are not easy to go to, but that's where the gold mines are. Now there are, so if someone is, obviously the preliminaries you have already passed, you are already a medical professional, you have passed those, etc., which I've already told you. Now comes to, if you have got 1 year of full-time experience, and you are able to find you are able to secure a job, and the employer is willing to sponsor you, the for the employer there's only one minimum and the basic criteria, that they have to offer you a job which will be more than $76,515. That's the salary threshold. No other profession, no one can sponsor someone from overseas below this job. So this is, and for sure I'm that for doctors and others, that is far much more than this, but this is just the basic thing, that someone has to offer you more than this job. And if the interview goes well, the employer is willing to sponsor you, and if someone has got more than 3 years of full-time experience, you can negotiate with the employer, and they can also offer you a permanent residency visa that is called 186. So otherwise, the common step is that people come to Australia on a 482 temporary uh, visa, stay there, work with the employer for the next 2 years. Obviously, the employers are sometimes skeptical as well to employ someone for just on a permanent visa, because there had been instances in the past when the employers sponsored someone, the person came here and then uh, never came to work again. So employers are a bit skeptical as well. So that's how the process works, 482, 186. And there are lots and lots of lots and lots of visa opportunities every year. If I talk about past this current year, there are 44,000 allocations of spaces for this visa. 186 visa, 44,000 people will be getting their permanent visas in Australia. If the This was if you are able to find a sponsor. Second one, if for example you have passed all the exams, you have done everything, but still you couldn't find employer, because it can be hard. So certainly nothing to worry about. We are not short of pathways. The most common one is the general skill migration. You can find all this information on internet as well, but we have tried to consolidate and try to hand hold you so that you all could be you can you, so you don't find it that it is so confusing and so hard. So general skilled migration is there. This is a points based system where we ask you first of all to do your skill assessment, which is pretty much the registration. Once you have done that, based on what's your age is, what's your work experience is, what's your English score is, and other things like, for example, whether you are married or not. If you are married, what's your partner skill, can your partner pass English test, and all those kind of things are there. So based on that, you get your points. The minimum points is 65, and for yourself, for doctor, someone who has got say 1 year of experience, 3 years of age, you can, and plus 7 each in English, IELTS, etc., or PT or yeah, OET, etc. You could easily find yourself around close to 85, 90 points. Again, this is general in nature. Please don't count me for this that you told us on the call that we can get 85 points, whereas we are not. Like I said, this is based on our experience, but everyone's situation matters from circumstances of their own. Once you get your skill assessment, we calculate your points, then we put your application in a pool. You think like that's a pool where all the candidates across the world will be putting their applications. That's called expression of interest, EOI we call it. So EOI will be there where someone has got 75 points, someone has got 95 points, 100 points, all sorts of points, all sorts of professions, and then from time to time government does the invitations, and then okay, if someone who has got say 75, 85, whatever the points may be, they will be inviting you and will be giving you 60 days to prove what you're saying. So in that expression of interest, someone on like we will be representing you. We will be saying, okay, my client A has got, this is the English score, this is the experience, this is the age, etc. So pretty much you will get 60 days to file that application. Once you get the invite, 99% of the times someone who's been invited will be getting a PR, permanent residency. And if we talk about the allocations of this visa, 185,000, like in Australia, which we talk in this terms, like in our term, we'll say 1 lakh 1,85,000 people will be able to get permanent residency under this pathway for this year as well. This was for previous year as well, this number, and this is the same number for this current year as well. So nothing to get disheartened or so. You just need to channelize your uh, your pathway, like your efforts, how to do that, and we'll be able to assist you with that. Like I mentioned, there are 4 pathways. So these were the 2 pathways. The third pathway, you can come on a visitor visa or a short stay visa as well, just to pass the exam for the after the MCQ exam. And once you're in Australia, you pass the exam, you can then again start looking for employers, or can certainly put the expression of interest as well. And the fourth one, which is again, this is a pathway but not so common, that someone can come on a partner, parent, dependent visa, student visa, or ETA, depending on your passport. Bangladesh will not have this option, Bangladeshi passport, but sometimes someone can have some other country's passport, where you can come on a without a visa to Australia. So these are the pretty much the 4 pathways. If I talk about statistics, numbers. So I'll put it in this way: health sector comes in the highest priority when it comes to those 185,000 people who get permanent visas every year. Out of that, the healthcare sector has got the topmost priority, the top number of seats. Out of that, if someone asks me how much is the allocations for health sector, engineering sector, there is no fixed numbers. That is something where the government keeps it to themselves. But this is very fair system. Everyone can follow that. Everyone can understand that. When we talk about Australia, 3.5 people against every 100 people. That's the average what that comes on the APRA website, that to every 100 Australians, 3.5 people work in this sector, health sector, which could be either be pharmacists, chiropractors, doctors, GP, whatever, total. And closing on 1 million registrations for health practitioners uh, last financial year. If I talk about our platform here, something to boost your confidence. If you see the statistics here on my left-hand side, new medical practitioners registration. This is for the year 2024-25, 4,947 international, 4,125 domestic. I'm quite confident this is quite easy to understand that close to 5,000 doctors, pharmacists, medical professionals got their registrations last year compared to domestics one, which is 4,125. This was actually quite interesting as well, because if you see on the left hand side below, doctors GP wise, females were 47.2% and males were 52. So more number of males, less number of females. Whereas if I compare the same thing for dental practitioners, more of female, 57% female and 43% male. This is for dentist registration last year. So this is again something to think of. And plus, again, if I see the international numbers, 400 70 international dentists and 1012 domestic students. So this is something to boost your confidence, to show you might think this is confusing, you might not know how to do what to do. Don't worry, you are in safer hands. The panelists whom you have been speaking to, they have done so well that certainly they are putting all their effort to get the community here. So overseas trained practitioners play a critical uh, role here. You just need to pass the exams. We'll be able to guide you across, and like I mentioned previously as well, regional and employer sponsored pathways often offer the fastest outcome. So employers, but outside Sydney, Melbourne, outside in other parts of Australia. And if you think that if you have passed the exam, that's the only thing, you will certainly need a professional like us. So we'll be able to guide you across right from the time where you have to make up your profile to finally coming to Australia, and everyday questions as well with the and certainly like I told in the beginning, like I've come across many a times that people from overseas say their agents gave them a package deal, 10 lakh, 20 lakh, 30 lakh. We don't work like that. No one from Australia will work like that. We charge and we talk about in step by step as well. Once you pass the first step, then only we move to the second step, and all the moves are lawful. Nothing, no, no, like other means are used. You can certainly contact us. This is our name of the website, Wise Advice Visa. That's our business name as well. And we certainly go with our business name as well. We will be able to tell you clearly whether something can be done or not. We many a times get our clients not so happy as well, because we tell them no, that's not possible. So sometimes people try to want to for us to bend the bend the rules, overlook for the things. We can't do that. So this is pretty simple. So you can certainly contact us, wiseadvicevisa.com.au/book meetings for your personalized meetings as well. We'll be able to talk to you about that. So thank you for this opportunity, and you can also scan this barcode as well for our information to follow us on Facebook, Instagram, and other means. And certainly the panelists whom you have been speaking to, you can contact them. They'll be able to pass on our information to you. Thank you for the opportunity to everyone. Thank you.
Thank you very much, Mr. Pushminder. Good evening, everyone. Thank you, everyone, for joining us today. Thank you to our speakers for their beautiful presentation. I am Dr. Rumana Afros from ABHF. Welcome to our question and answer session. Here we have Dr. Sajidul Islam and Dr. Suranjana Jennifer Rahman with us. Let's begin with our first question for the panel.
So I have a question from someone asked. That person is a trainee for cardiology in FCPS Part 2, and they will finish the FCPS soon in cardiology. Is there a possibility for them to come to Australia in any pathway?
Thank you, Dr. Sajid, and thank you for the doctor who raised the question. Basically, there are two pathways. One is the very basic one, which we know about the AMC and all these things. If someone have done the post-graduation in any other countries other than Australia, they can also come here, but that will be a different pathway called a specialist pathway. So basically, the degree the doctor achieved in their own country will have to be accredited in the relevant Royal College in Australia. Like if someone has done the FCPS pediatrics in Bangladesh, that needs to be accredited by the Royal College of the equivalent Royal College in Australia. Then they can apply for job and all these things. So I think it will be a bit tricky discussion, which we will be addressing in near future in another webinar, especially for this specialist pathway. So then we can focus more lights on that matter. Thank you.
Thank you, Dr. Shotajit. Another question from one attendee from Queensland. She is a student doing a master's in some other course, and her study will be finished by 13th of March 2026. She was a pharmacist back in Bangladesh. So she has 8.5 years working experience as a senior production pharmacist at some laboratory. And recently she passed her OPRA exam conducted by Australian Pharmacy Council. She has also done her skill assessment as an industrial pharmacist, but is still can't able to manage any intern pharmacist position or any job related as industrial pharmacist. So she wants some suggestion of the way and opportunity that she can use to become a registered pharmacist here. So can anyone answer this one? Suranjana?
I could answer this question if you want.
Thank you. Can you hear me?
Yes, we can. Yeah, proceed.
Okay. Thank you. Thank you for the question. Thank you for reaching out to ABHF. As you all know that ABHF is a platform for all Bangladeshi health professionals. So I have taken your details, and definitely ABHF will contact you. In very near future, we have a plan to do a separate session on the Pharmacy Council exam and the job placement, and the very hardest part, probably getting an internship as well. So definitely ABHF will contact you, and we will be in touch with you shortly. Thank you.
Thank you, Dr. Suranjana. So there's another question of someone from Bangladesh, and she appeared for MRCS Part B, now interested to start studying for AMC. Her question was, with MRCS, what will be her pathway to become a surgeon in Australia? If not possible, then what will be the preferable pathways for her? So
if I can answer that. So for she's MRCS Part B. So the problem is In Australia, if you have a UK degree but you don't have a GMC registration and you haven't worked in UK as a consultant and get your FRCS and no experience, I don't think you can directly come to Australia as a specialist. Unfortunately, that's not going to be possible. So in that case, the option is to give the standard pathway. That means you give the AMC exam and then come to Australia, get a job in the hospital. Because if you want to be a surgeon, that's what your only pathway is. Get a hospital job, pass the clinical exam, and then go into the surgical training, which is slightly difficult than in compared to the medical training. But unfortunately, the MRCS will not be counted until you work in UK and you got your GMC registration and work for at least 1 year plus. I don't think less than that, it will not be counted, if I'm not wrong.
Can I quickly supplement to Dr. Sajid? Is that I understand the reason for raising this question. In GMC, if you have a member fellowship from any membership in the Royal College like MRCP or MRCS or MRCGP, MRCOG, you can skip the PLAB exam. You can only sit for the English efficiency exam and get the registration. Unfortunately, that pathway is not valid in Australia. So only coming in Australia in two ways. One is the AMC pathway or the specialist pathway. Thank you.
Thank you very much for your input, Dr. Satyajit. So there's another question. Is there any age limit for AMC? Maybe
Okay,
Dr.
yeah.
Sorry.
There is no age limit. There is no upper or lower age limit when you are planning to sit for the Australian Medical Council exam, and I believe that's the same for the ADC exam as well. The only thing that the candidates need, that they need to have a recognized primary medical degree, which we call MBBS, from a institution which is been listed in the World Directory of Medical Schools. But for the skill migration, there are usually some age restriction, and it's need to be often under 45 years, if I'm not wrong, Mr. Bedi. So school, the sort of skill migration, there is an age restriction exist, but in general for AMC or ADC, no, there is no age limit.
Thank you, Dr. Mahbuba. So another question is, can I do skill assessment if I pass AMC Part 1?
Abhishek, do you want to answer that?
I have no idea about the skill assessment.
I don't think there is any skill assessment exists for doctors in AMC. A skill assessment is automatically done when you get your upper registration. You don't need a skill assessment individually.
But probably there is a scope. I'm not sure who want to do the pesky and work after hours in the city areas. So before that,
Still you have to get the upper registration.
okay, yeah.
So when you get the upper registration, that's a skill assessment.
Sorry to cut you. I think for the specialist pathway, once you get that initial stages, after that, they will ask you for a skill assessment. I'm not sure whether she meant or he meant that. Yeah, so the question was not very clear. But certainly just after AMC Part 1, there is no skill assessment just for that.
Okay.
I think the question was regarding the permanent residency pathway. Like, there are other way, 2-3 years or 5 years ago, people used to assess their medical degree for occupational health or safety officer or medical admin or those things. And it depends on each state if they want to have state sponsorship visas. But these visas are very, very short these days. Like, it's not very common. Sometimes it opens for probably 2-3 months. Mr. Bedi, you tell me if I'm wrong, but what I heard that, sometimes if there is any skill shortage like Northern Territory or Adelaide or somewhere, they probably will open the opportunity for 3 months and then it's done. the visa opportunity is gone. But this is very, very rare these days. Skill assessment as a doctor is very rare. The only option is to get the AMC Part 1 and then try for any visa, the four categories, and then apply for those visas rather than getting a permanent residency or a temporary residency or a state sponsor residency straight away. Thank you.
Thank you very much. Just to add on, if any of the participants feel that you need more information or your question has not been fully answered, please feel free to reach to us. We'll be happy to give you more information. So another question: what are the chances and probabilities of getting GP jobs after passing AMC1 in Australia?
I will duck into it. I think the probability is very dependent in a sense. If you are very experienced with your skill in emergency medicine and anesthetics and ICU medicine, some cases rural and remote jobs are available and they will be happy to sponsor you provided it's very remote, like Aboriginal communities or very, very remote communities where they need a doctor and they need a skill, especially anesthetics, and that's very much high in demand. But in general, there are lots of candidates who are actually in Australia already on a visa. And if they have the AMC Part 1 and they are applying for PESCI, I think they will be prioritized because the visa trouble is less and there's less chance of sponsorship. Because it's very easy to sponsor who is in Australia. It's very hard to sponsor someone from outside Australia. It does happen, but does happen for mostly UK or Ireland or New Zealand doctors where they're very happy to sponsor because they come in a different pathway. But I don't think it's that easy to get a job from Bangladesh or come. But as I said, it's not impossible. It is possible. I think you need to be stick to plan, perseverance, application. I think in the next session with Abhishek in the AMC session, I think Abhishek can enlighten into this thing because he's probably going through the same process now.
Thank you very much, Dr. Sajid. So another question. I have completed MS Anatomy in Bangladesh, working as an assistant professor now. Does this degree will help me in any service to move in Australia, or how can I proceed to work in basic science in Australia?
Abhishek, can you answer that? Because
MS in Anatomy.
MS in Anatomy, okay.
No, I have no idea about that. But
I don't think MS in Anatomy
it's a non-clinical pathway. Yeah.
No, APRA doesn't recognize it at all. So unfortunately, if she wants to come as for a PhD or something, that's a different scenario and a different categorical thing. But I don't think
wants to know about clinical pathway.
I don't think there's any clinical pathway for someone with MS Anatomy. It's the same thing. If she's in MBBS, she can apply for the AMC standard pathway anytime. So it doesn't matter if she's in MS Anatomy or not, but she has to give that exam.
But if she's interested about non-clinical, or if she wants to be in her subject in anatomy, she wants to go in research, there are so many other opportunities there. Yeah.
So, but she has to do the PhD or MPhil or MS or something like that again.
Yeah.
Or another master's in any of the universities.
Any of the universities.
She can pursue
I think anatomy MS is available, I think.
Yes, yeah, absolutely.
Thank you. So the next question, what is the prospect of a specialist pathway in medicine and hematology if someone completed FCPS and MD and PR process later on if age is more than 40? So the question is a specialist pathway in medicine and hematology, and he completed FCPS and MD, and he also wants to know about the PR process if age is more than 40.
He should apply. He's in a very good position. He should apply for the specialist pathway, and he should have his whatever the experience and things been assessed and verified. And I believe Mr. Bedi was also talking about if he got a job offer from here, that will be even quicker and easier.
Just to add on, Dr. Mahbub Mukta, that I think the candidate should be contacting the Royal College of Physicians in Australia first to validate the degree, the FCPS Bangladesh in medicine. If they validate, there is a very good chance, and I know few people, especially in pediatrics. I know 2, 3 people who recently came from Bangladesh to Australia after completing the FCPS. So there is a good chance,
Yeah, he's a
but
very good candidate.
yeah,
Yes,
very
yes.
good candidate. And I think we may, because this webinar encouraged us a lot because so many overwhelming responses. Hopefully, we'll be arranging something for this specialist very soon. By this time, the candidate should be contacting the Royal College of Physicians, Australia.
Yeah,
Thank
and
you.
we can also directly contact us. We will leave our contact details on the message box. So please feel free to contact us directly, and we will definitely support you, and then we will able to talk further from there.
Thank you very much, both of you. Just to add on, for time limitation, maybe you won't be able to reply all of the questions, but feel free to reach to your. We will try to reply all of you after the session is over. So another question, I have passed AMC and completed OET. Now applying for job, but can't manage it for last 4 months. What should be my next journey? Is there a limit for PR for doctors? I did not get the question completely. How to prepare for CB and selection criteria?
Can I ask the candidate to send us an email regarding his situation? Because it's very hard to say in these words that what situation he is in and what his experience level is. If he can email us the things, we can connect with the right mentor for him who can actually guide him. I think that will be better because it's a very hard question to answer because he's trying for 4 months. Unfortunately, I tried for 7 or 8 months before I get my first job. So I don't think you should lose your hope. You should keep trying, but you should also keep trying for your clinical exam also, because once you have clinical exam, you have a much better chance of getting a job. So don't lose hope, keep trying, but please send us an email with your CV and everything. We can actually attach with you and a mentor who can actually guide you and help you.
Thank you, Dr. Sajid. So a question for, I think it's for Dr. Rizwana, can reply this one. Currently, I am an intern doctor. Now I want to apply for MPH in Australia. Can I give ADC after completing MPH? Dr. Rizwana?
Thank you, Dr. Romanapo, and thank you for the question. Sure, you can come as a student in Australia to do your MPH, and while you are doing your masters in public health, you can pursue ADC. You can start your ADC journey as well. I think it's a good idea when you come as a 2 years student visa. You start your ADC journey, and then you get another 2 year for post-study work permit here. So within these 4 years, if you target to finish your ADC exam, which will be good for you for your future journey. I hope I answer your question. Thank you.
Thank you very much. So another question she wants to ask on behalf of a friend who has done UCMLE Part 2 and in middle of her residency program in USA, but she wants to move into Australia now. So she wants to ask about the processing. So she has done UCMLE Part 2.
I think she's a very good, he or she, whoever is applied for it, I think she's a very good candidate. I think they should contact. I think their pathway is not a standard pathway. They will have a different pathway. Abhishek, if I'm wrong, if
Yeah,
you can correct us.
no, it's right. Thank you. We already discussed that there is a competent authority pathway who have the
Yes.
registration. So I think you can do a research in online because it is all in the AFRA website. But here may be a tricky part. I don't know he got his full registration or not. So in the middle of the part, whether they recognized or not, I think you can do a research or go to the website. You are eligible for the competent authority pathway. That's all.
Thank you. Thank you, Dr. Abhishek. So another question. What are the process or probabilities to get an internship after MC Part 1, that means MCQ exam, if there is any?
I think there is sometimes you should keep your eye on the job advertisement when or the so I know some of the people who already got their internship here in the country, and he just completed his or her MBBS in Bangladesh and started from the internship here. So I think that's a good opportunity, but it is possible. So you just mail us, or you do a research, or keep your eyes for the advertisement for the different state. They when they launch about the internship program, you can apply for that.
Thank you very much, Dr. Abhishek. So another question, she or he wants to know if it's possible to apply for 189 or 190 or 491 visa after provisional registration, not the general registration.
Yes, I can answer this question. The simple answer to that is no, because 189, 190, or 491 are under general skilled migration. So under this, the doctor has to have uh, full registration. So simple answer to that is no. However, in saying so, the other visa which I mentioned earlier, the sponsorship, the 482 visa, that could be applied based on if you have a employer in Australia who's willing to sponsor you. There was also the in the, like few questions back, the factor of age. So for general skilled migration, the cutoff age is less than 45 years of age. So if anyone has passed that age, so which means the chances of getting invited for general skilled migration are very bleak. However, for the sponsored one, that can go up to 55 years of age.
Thank you very much, Mr. Pushminder. So another question for Dr. Rizwana. Is there any specialist pathway for BDS doctors? Rizwana?
Yeah, thank you, Apu. Unfortunately, there is no specialist pathway for dentists in Australia. You have to do you can do masters in any subject, but the priority is you have to pass your Australian Dental Council exam. So this is the first rule, that you have to pass your ADC exam, and then you can do, if you want to do any specialization, you can then apply for masters or any other specialization program. Thank you.
Thank you, Rizwana. So a question came that I have completed AMC Part 1, now preparing for PTE. I have 6 years of clinical experience and 3+ years government service. I want to know about level 1 GP supervision and its chances to get in Australia.
I think
Should
we
I
answered this question in the previous one. As I said to you,
the same?
we didn't tell the age in here, but I think the chances are there. You have to stick to the plan, keep applying, but CV in Australia is quite different than CV in Bangladesh. So you might have to check the CV if it's the right CV for you. Most welcome to communicate with us. We will try to help you. Please send us an email with your details. We will try get in contact with you. Okay.
Okay, so I think Dr. Shotajit already answered the next question, that if I completed AMC, will I be able to join specialty training with MRCS GMC registration?
Yeah, it's already been answered, but don't worry, our session is recorded, so we can always go back to that question. Yeah.
So the next question is, I am a private practitioner like GP in Bangladesh with MBBS DCH for 23 years. I am 51 years old. Is it possible if I start my journey to give AMC MCQ? Is my age would be a barrier? I will be happy if I got a realistic answer, please.
Can answer this question. Obviously, age is a factor. Like I mentioned earlier, for general skilled migration, the cutoff age is 45 years of age. But based on your experience, I'm sure if you pass the exams, if you are able to find a employer who's willing to sponsor you in situations like yours, cutoff age could be changed, could be up to 55 years of age.
Yeah, I think
Okay.
he needs to apply to the area of shortage, remote and rural area. They will be more than, I think, willing to get anyone at above 45 if they have a real
Of that
shortage.
experience. Yeah.
Yes.
Another thing I just want to add here, I just like to encourage him, because I can share a real experience. One of my students who passed recently, the 2 months back, he passed the exam. His age is around 50, and he is a medicine specialist in Bangladesh. So he has a huge background of clinical practice. So at 50, I think it's not a matter.
You should definitely try. Yeah, age is just a number, so keep trying.
Okay.
Definitely.
Thank you very much. So another question for Dr. Rizwana. After passing ADC Part 1, does anyone get provisional registration? Can I apply for jobs in Australia while preparing for clinical exam?
Thank you, Dr. Romanapu. Unfortunately, in ADC, we don't have any option for getting provisional registration. We have to finish both the exams to get the final registration from AFPRA. What usually nowadays, like my juniors, as I know that what they are doing, they are giving the exam from Bangladesh, finishing part 1, and some student visa or some training visa. So if you can, Dr. Bedi, like Mr. Bedi can say that any visa, if you can come and finish your part 2, then you can just apply for your registration from AFPRA, and then you can apply for job as a dentist. Thank you.
Dr. Rizwana, don't go because there's another question for you, the next one. I have done my skill assessment. How can I start preparing for ADC Part 1? I would be very grateful if you give me an idea of the necessary books or materials.
We will be organizing a brief overview of ADC exam in our next session. Hopefully, I can cover this whole part about the part 1 exam. But just to give you a short answer is after you are one step ahead, which is very good. Congratulations. Now you can just target a month, like usually it happens on March and September. So you can just target and you start preparing yourself. There are a lot of online courses as well, which we will discussing in our next session. And book wise, you can always start with therapeutic guideline, which is the Bible of ADC, and some journals and also infection control guideline. They are very helpful as a starting of your preparation. Thank you.
Thank you very much. So the next question is many thanks for organizing. Okay. So I am a psychiatrist working in UK for 7 years. Assume I need to come through a specialist pathway. I wonder, will there be any issue to get PR? As I just heard, upper age limit for PR is 45 and I am 49 now. And just to add on, I have completed my MRCP in psychiatry.
I think the age is 45. It's for skilled migrant. It's a blanket cover for any profession, any skilled person, regardless of medical or dental background. But because Australia have shortage, we have the doctor, nurses, and the dentists, these 3 areas. I believe this skill migration, it's going to be area basis. Correct me if I'm wrong, Dr. Bedi.
That is correct. So if we are able to secure a job and the employer is willing to sponsor us, the age limit could be up to 55 years of age. But that's the only one. The other one, the general skill migration, 45 years.
Yeah, but when you're saying general skill migration, it's for everyone, like engineer, IT,
That's right. Yeah,
teachers, everyone.
yeah.
But
That's right.
doctors, nurses, dentists, pharmacists, all the healthcare profession, we are in a little bit of privileged, I think, situation when we compare to the other skills.
And I think he wants to know about the specialist pathway.
Yes.
We're going to go through that in our next session, isn't it? One of the session, Dr. Vadra is going to go through. And then it's looked like there is so much interest in this specialist pathway. ABHF will organize a special session with a specialist on board.
Thank you very much, Dr. Mahbooba. So I think another same question again. For a specialist, is AMC mandatory? Yes.
Mm-hmm.
And
Yeah.
I think there's a few exception provided which country you're coming from. Like if you are doing a specialist in USA, UK, Ireland, completely different scenario if you're a specialist
New
in
Zealand,
Bangladesh.
Canada, yeah.
Yeah, so you have to choose, we need to know exactly which country you're applying for. If you're coming from Bangladesh, I think that's mandatory, but there is an exception. I've heard someone actually bypassed it because of the experience, and Royal College has accepted that. But because of the way he prepared his application and everything. So it all depends. I think There are a few organizations who does it. In our specialist pathway thing, we will actually talk about it. There are organizations or there are centers who help you to do that. They obviously charge you money, but they do that for you. We'll definitely talk about it on that particular matter. But definitely there are a few things can be done in Australia. They do it now for a lot of specialists.
Thank you, Dr. Sajid. I think the next one is for Dr. Abhishek. Please encourage him, this person, whoever. AMC portfolio seems to be a complicated one. Had mine one once. I don't know whether he meant that he did once or not, but it seems to be invalid now and it has crossed 1 year. Can you please clarify the portfolio procedure and booking process for AMC 1?
Okay, thank you. Thank you for the questions. And I will discuss in our next session regarding this. But the very basic thing is that you just need to do some YouTube search with the how to do the portfolio, how to do the EPIC verification. You will get a lot of video there. And another thing is that if you have any problem with the EPIC registration, you just mail them. And they are very helpful and they will solve your problem, because this is a very simple thing. This is not tricky, but I unfortunately I found all the doctors they become hesitated to start because some people bias them. So my also a suggestion is that you need not to listen anyone who haven't gone through this pathway. So it is very easy, and even probably you can get some video in our AMC mentor page as well, or just knock there. I will send you our some of our recordings video, or you just get a details video in YouTube. Just search how to do epic profile or create like that. Thank you for your interest.
So Abhishek, for your reply. So the question next one is, I have completed MPhil in biochemistry. I have teaching experience for 5 years, 5 years or more. How can I process? What is the best option for me? So MPhil in biochemistry with 5 years experience with teaching. How can he process?
I think we answered this question on the anatomy thing also. Preclinical, that means anatomy, chemistry, biophysiology. If you have an MPhil degree, unfortunately, it is not counted in Australia for APRA registration. So sadly, you have to give the AMC exam if you want to come to Australia as a doctor. But if you want to do as a researcher in the university, that door is always open. And if you need any help on that thing, Pushpinder can help you to find the right institution who can actually do biochemistry teaching. I'm pretty sure that happens in Australia, so you can do that. But if you want, it's a PhD or something if you want to do.
One thing I can add on is you mentioned that you have got 5 years of teaching experience. Again, after medical profession, teachings are something which are always in demand. You can contact us tomorrow and we can talk about that. With your teaching experience, we can if we can get a skill assessment for teachers. The biggest thing is the IELTS test 7788. So if we can pass that, for sure we can uh, talk about those PR prospects.
Thank you very much, Mr. Pushminder. So the last question is for Dr. Abhishek. How to prepare while doing internship for AMC Part 1?
Okay, thank you for the questions. So before answering the question, I just want to add something with the previous question. I think the person who asks for the anatomy degree or like that, I think that can be also helpful. Like you can blend it with the teaching as a skill migration as a teacher in university. So it just pop up in my mind. And the next question is, yes, internship. I think it's the best way. And some of my students I used to teach in the medical college. They already started their preparation in the internship. I know some of them. So it is easier. So I will give you the in-depth guideline in the next session. But it's the simple, make it simple. Just bring some books, John Murtak or a step to CK, USMLE. I will give all the resource in the next session. And you just have a look beside your roster. For example, you are in the medicine, do the medicine part. You are in the PD, you do the peds part. So in that way, I think it will be helpful. And definitely, I will give you the in-depth guidelines in brief in our next session or on for 17th April 2026. Thank you.
Thank you very much, Dr. Rishit. So the last question for tonight's session for Dr. Rizwana. Can I work as a dental hygienist after passing ADC Part 1?
Thank you, Dr. Romana Afrosapo. Unfortunately, no, because it's a different occupation here in Australia. Like dentist, dental prosthetist, and dental hygienist, they have different pathway. We have ADC, so also dental hygienist needs to go for this exam to have the license. So without dental hygienist license, you can't work as a dental hygienist. Thank you.
Thank you, Dr. Rizwana. So sorry for the time limitation. There are more than 30 questions waiting in the panel. We could not answer them today. However, we will be answering those over the next few weeks via email, and we are also running other session, other webinars. As we already have everyone's detail, we can send email. And I will now ask Dr. Suranjana to end the session, and some of the attendees also asking for our email address. We can provide it. Apologies for the time limitation, and thank you so much for all of your understanding. Thank you all the attendees. Thank you all the speakers. Thank you very much.
Thank you, everyone. First of all, I must thank these 200 attendees who attended today for this ABHF webinar. And it took all of us, I believe it took all of us to our very first days when we came to Australia and there was no ABHF. So my sincere thanks to ABHF for bringing all these newcomers, new doctors, or experienced doctor who wants to make Australia home. So and it's not an easy thing, and it's not very difficult as well. So this is a dream everyone can have and we can fulfill. ABHF will be always be there. We have almost 35 questions still waiting. We have a time constraint. It's almost 12:30 midnight in Australia. Definitely, we will get back to you, every one of you, by email. I will be sharing our email address, which is abhealthforum @gmail.com. So our next webinar will be on 27th of April, 27th of March for ADC, and 17th of April for ANC. And we will talk more and more details about it. Thank you everyone for tonight, for joining us. And any question, any concern, you can email us, abhealthforum@gmail.com. I repeat, abhealthforum@gmail.com. You can actually message to our social media page as well, Australia Bangladesh Health Forum, ABHF INC. And anytime, any question, and this is now a small world, any of us can be found in social media. Please contact. This is a brotherhood, this is a sisterhood. We will make sure everyone will proceed or will shine together under the umbrella of ABHF. Thank you, everyone. Thank you for tonight. Good night.
Thank you. Good night.
Thank you all. Good night.
Everyone,
Thank
good night.
you. Good
Good
night.
night.
Good night.